Thanks for your time, Doc. Appreciate it. So how bad is the situation there?
Yeah, look, when you compare us to the other provinces, we're really moving very fast. And funny enough, it's just two districts that are really creating a huge surge. That is Nelson Mandela plus Parkman. In terms of hospitalization, we have about 764 patients yesterday. Half of those were in private sector, other ones were in the public sector. Our ICU have just about over 35. Over 460 patients are actually in hospital. Over 167 are on oxygenation, and there are about 25 patients who are on ventilators. I think in terms of the capacities, if you look in PE, you recall that we have the big facilities that the Volkswagen South Africa with field hospital that has about 300 really high care, intensive critical care beds, and they've got a total of about 1,400. We've also had a huge number of new investments in Livingston, in the other hospitals around. So in terms of bed situation, we are okay. And also we've been working, and the province have really invested in oxygenation. But I think our biggest concern is really the numbers that are growing very, very fast.
I'm seeing stories about you running out of intensive care beds, though, in Port Elizabeth. And many would argue that there was not enough preparation done because you're in this position. What would you say to that?
Yes, actually, when you look in terms of the private sector, we have about 60 now of the ICU beds. What's usually happening in these issues, it's really the number of the magnitude of patients that are coming in one time. You recall when we really started in the first wave, we needed about 3,000 beds, 3,000 ICU beds. We built over 300 of those ICU beds, and we have not really fully utilized the ICU beds. The private sector has actually been running out of ICU beds. We still have some ICU beds in Livingston and other hospitals as well. But I think the key issue is that if we grow at this level, our system is more likely to overwhelm. But capacity at the moment is still very there in terms of capacities. What is really going to be a big problem is going to be the ventilation and the ICU bed, but the broader capacities of managing moderate to severe patients, I think we've got a lot of capacity for that.
And whose fault is that, though? Because, some patients who are on death's bed would argue that you haven't prepared enough for the treatment of patients who have COVID-19.
Yes, actually what is important is really to remember that in terms of the preparation, I think this is really the experience in Europe. I mean, if you look in the British, if you look in the US, if you look in Italy and all that, it's really the fastness of the numbers that actually grows. It's literally like a big storm that comes up into a well-run city with good sewage system, but a sudden big storm really raises the water. I think that's really what we're trying to do. To prevent that we shouldn't have a very high number of cases. And the strategy that's been now on is to reduce the number of cases that we actually have. But when you look in terms of, this is also very important, when you look at the number of cases, you also get worried about, the number of deaths that's actually happening. And if those deaths come very high, you then have a worry. And you also look in terms of what is called excess death, those deaths that probably you don't see in hospitals, but they're also happening at home. That is a combination of two issues. One, the COVID makes a huge contribution, but because most of health services have given way to COVID, you might actually find that some other conditions are starting to raise the number of deaths. So we need to be balancing all these, and these are a big consideration in the new strategy.
And very quickly, I know that there can be a different approach to how you handle a second wave, because we heard KwaZulu-Natal say if they reach proportions of high numbers, then they might ask the National Coronavirus Command Council for stricter measures. Would you consider something like that?
I think we are really reliant on the experience that we had with the old COVID, and I think we're also very reliant on the levels of levels 1. If you look, we actually got most of the restrictions lifted in level 1. We had kept those cases. What we think is happening in the PE areas is non-adherence to the stringent measures that are working. We think people should be more on a mask. We don't have sufficient masks in the PE areas in South Apartment. People are not responding. 2, we think we need to make sure that people are not staying in big gatherings where they are crowded without masks. We think that's not happening very well. 3, we're finding that there's still a lot of parties. Shebeens are still very open. People are not adhering. So the strategy is critically looking into that. At this stage, we think that the efficacies of the mask, social distances, washing, close, removing big gathering, banning big gatherings, and making sure that we're adhering to the level 1. I think that will be, obviously, if it has to come to the worst, there would be a differential lockdown. It won't really be lockdown of the entire facilities. But our strategy is to enforce really the levels that are available to us and make sure that communities are taking more responsibilities. We're decentralizing to the district jobs, and we're really mobilizing our leadership to actually talk to communities, to adhere to some of the restrictions that are available, to really care.
Doctor, quickly, and I'm going to try and get a yes or no answer from you on this. I know it's very unlikely, but if somebody gets COVID-19 in the Eastern Cape, do you confidently say that they will get proper treatment at facilities? Yes or no?
Yes, I think I can confidently say that. And I think this is really part of the investment that has been done. We really expanded the oxygen available. We're expanding our case management. Dexamethasone is available. Ventilators have been provided. And most of the care in the central systems are available. And there's a quite number of available beds. And what we know now, the treatment propositions are much better than we had in the first wave.
I'm glad you said it, and I'll hold you to it. Thank you so much for your time and your insight. Appreciate it. Eastern Cape Premier's Special Advisor, Dr. Thobile Mbengashe.